are really excited to be here. A quick show of hands. How many of you have had therapy since you've moved in? Everybody's familiar, yes. Okay, good. Most of you probably have had some therapy or understand what therapy is. We are not changing that component. We are actually bringing on a lot of the Health Pro team, so they are going to stay. What we're doing is Bayada is a home health and outpatient provider. So we are going to be able to provide a full continuum of care to you all. Seamless to you. We bill all the insurances, or we take all the insurances, so it won't be any change, but there won't be that differentiator between you guys, which is sort of what the best you guys grow and actually research. So without further ado, I'm going to turn it over to Mel. I'm going to hand out some information so you guys can review it, ask questions, and we want to quickly introduce some of our team that we have here today. Not everyone who is going to be regularly here is here today, but we'll be sure to have some more events as we thank you guys for excited to be here.
It's nice to close my mouth so that it works. I thought the fake that look at like, I can't hear, is that thing on? So like Megan said, I'm Neil, I'm the program manager. Big title that doesn't mean a whole lot, except that I'm your go-to person. If you feel like you need therapy for any reason, I will be handing out my cards. You can reach out to me or the staff here, and I will help facilitate that for you. I am not, however, the person who will be doing all the magic to make you all feel good and move well. That's our team over here. So starting closer to the windows, we have Michael. He's a physical therapist. He'll be supporting you all. Next to him is a face you all know and love already. That's Francis.
Therapist.
Then we've got Karen, our PETA, who will be working alongside Michael. And this is not our whole team, but we did want to kind of bring some of them just so you could start to recognize the faces that will be moving around the community. Know that if you have any needs, have any of them. I do know there's been some question, the team at the landing on what is the process on getting started with therapy. So just like with what you all had to do before, everything starts with the doctor's order. So whether you have your doctor on site here or an outside provider, we need a doctor's order. Anything with you, your insurance, biggest part is anything you don't need to. If you have not had a doctor's visit or you don't know how to reach out to your doctor, that's another time where you can reach out to me and I can help. I can send them a fax, give them a call, and let them requesting and kind of move that along for you. Not the easiest if you outside. So once we have an order, we will check your insurance, make sure everything is good there, get clinical information from doctors so that we know what's going on, and then send out a therapist or nurse to evaluate you, whatever the need may be. Like Megan mentioned, we are a home health company first, as well as an outpatient provider. So what that means for you is it opens up a whole extra bucket of benefits that you all can utilize, where all of your services are typically covered 100% by your benefit. And then once you graduate from that, we can extend you through your outpatient benefit, which is what you're used to using, and then that gets you more therapy longer. Any questions before I just keep battling things? And I do know there's people over in Zoom land. I'm going to check the chat and see if they'll have space in the building, just like the previous provider did. So if ever you want to find someone, find us over that space. I do not know exactly what that is yet, but we will be sure. Second floor. Okay. Second floor by the gym, so you can pop over there to get a hold of us for anything. I do know that Health Pro is working diligently. They've been working over to us so that there's no delay in care. So we will be that and reaching out to anyone currently on services, just so you know that, services will continue, we just have to do a little paper. Yes, Jamie?
Question, and I'm not sure that all of our. So can you talk? So add, that whole, maybe, position management that would be to us that we.
So what you all are used to is outpatient therapy. That's the Francis and the Howlas who are out making sure functionally you all are moving around, staying independent. In the continuum of care, there is a home health benefit, which includes all those therapies that you were used to, as well as skilled nursing. So skilled nursing can come in and do obvious nursing things like the wound or take out stitches, that sort of thing. But what Jamie was mentioning is they also can educate and monitor chronic conditions. Say you have heart failure and your doctor is tweaking your medicines, that everything is. Our nurse can come and make sure those medications are effective and you're not having any side effects. Say you have diabetes and your sugars have been a little wonky and your doctor wants to adjust things. We can come in and make sure medications are appropriate, that your diabetes is managed, that sort of thing. Same with kidney disease and a whole slew of other chronic conditions that our nurse can just help monitor. It's another set of eyes that, you know, the building is happy to have with the doctors and making sure extra eyes on you, that you are being managed as fully and appropriately. With the nursing, also have therapy at the same, so you don't have to pick one or the other. It was kind of the case usually when you have a provider that's urgent. For you all to have nursing services, you have to discharge off of outpatient to get home health. But with us, you can have therapy and nursing in all at the same. Yes, ma'am. It can. We would have to talk closely with your doctor on how long that, that course of IV antibiotics or whatever it might be lasts, and make sure that, everything is set up ideally for you. Just because we can do it doesn't mean that it's necessarily what's best, but we can help facilitate whatever the best course of action will be. And if it's us, we can certainly do the IV support. So, Gotcha. So, I think the best person to answer that question that's out of the room. But I do know that the building has to function under the state regulations for assisted. And, I do not know the ins and outs of what they're allowed to provide versus what they can bring in. But, Kara and Jamie would be that stand, that's where you. I will, because
This is our home, this is my address, this
All services provided by us are under your home health benefit, provided in your home, covered by department. Correct. Yep, it's not, just because you're living in a doesn't mean that these are provided in a facility. It's still as if it.
So if I had surgery. Physical therapy. Medication.
So there's a couple layers to that scenario. Home health services by your therapist, your nurse to make sure there's no things. Home health aid. Insurance, they love to tell you, get a home health aid. But what they'll give you, hour, is not particular. And honestly, it's services that if you're looking at something like a companion or a CNA to be with you for a short time and help you within your apartment and that sort of thing, that is not covered by insurance. And that would be like a private duty for a short time that will connect you with companies that provide that as well as
Dropped out.
Center. Indy having. Explore.
so we will provide all the services that are covered under it, and we can connect you with any auxiliaries that might also be needed. And you're right, people with dementia or for whatever reason want to be give you a help. As a fiscal background, I will take the opportunity. There are some cases where it is beneficial to go. The amount of therapy that you'll get and nursing oversight in a facility that functions 7, and prioritizes therapy up to 3 hours a day is a different level than what you get. But it's always, weigh your own situation, but what makes the most sense for you. Yes. Absolutely. Yeah, and you all can rest assured that.
Nothing to add.
Yeah.
On it. It's so cheap.
Mhm.
Potential. It's not. Future app.
Find yourself.
Okay, why the land. And outpatient. Extension. So we are. Baselines and all you. And no. And that would be. Medical plan. really individualized based on your needs.
Appreciate. Understand. That's the potential that will able.
And Josh. Brings up a good point. If someone's having like a scheduled surgery, just know early. Have therapy ahead of time, explain this and then know what. So we can help. Practice.
It's a message there, unless that was your message to them. Okay. Thought I saw a question. But it looks like everyone got a little bit of collateral. I have my business card that I will provide. And then you'll be seeing a lot more of us out in the community. Feel free to grab any of us at any time. And we'll, set up some more events just so you can get to know us. We can do some screenings to help assess your balance and your fall risk. So look out for that on the calendar.
Now, one more little brochure that basically just says what nursing PTO and speech do. So if you have any questions on that. Thank you, guys. We are going to have more events coming in the coming weeks. Once we get the gym space reestablished, we'll probably have a little grand opening, a little party celebration. We'll get with activities and make sure we on the calendar. But we want to immerse ourselves with you guys, get our team involved so you know us and can tap us on the shoulder. Should any questions, we can do this line. Yes, so we are going to do monthly educational with you all based on topics you guys want to hear. Okay, so we're going to pull you guys or figure out what the trends are that we can do that. We're also going to do some in-services with staff so that they are well versed. And we're going to activity standpoint. Yes, so that is, you guys already have fitness classes set up, right?
Yes.
Okay.
Yeah.
Got it. Okay, yes. So part of our service offering in other communities is sometimes we are the ones leading the fitness class. You guys already have a strong fitness program, so we will just augment that if needed. We'll certainly be linked up with the fitness instructor, so if you notice someone who might need an opportunity for therapy, we oh, yeah, go ahead.
I think you just answered my question, but I look at private services that you get right here. They're not gonna go, that
They're
correct?
just changing names. That's it.
We're just changing to Bayada Home Health instead of Health Pro. Because Health Pro only had outpatient services and we do outpatient and the home health benefit.
I
Yeah.
thought that's.
We're just
Yeah.
augmenting, yeah. We're making one provider instead of two or multiple.
What is covered under home health?
Yeah, so home health services are your skilled nursing, so for your wound, your disease management, that sort of thing. Post-hospital monitoring, physical therapy, occupational therapy, and with the order of a doctor justifying surgery.
But if you need help, bathing, you had surgery. Help with showers.
So that kind of crosses over too. You can get occupational therapy to teach you how to do it and tips and tricks to make it safer and more efficient. But if you want someone to come in and actually help you, that would be under home care, private duty, assisted care kind of service. And
And that's not your,
that is not us, but we can help connect you with someone that can do that. We can be your resource to find the right people to bring in for your.
like,
All of that can be provided here. They'll have to fill out new forms. So you don't have to preemptively fill anything out. If we get an order and are at the time of evaluation, we'll go that street and you'll sign everything at that time. But you're not signing on, like you do with the doctor, say, my provider for all the time, it was just for that. Yep. Yep. They're gonna provide us all the information about him, what he's currently getting, what the plan is. He will reach out, get an order, and come to set up a new evaluation, and then at that time, you'll just, sign the form.
We'll transition.
Will
Yeah.
be,
Yeah.
yep.
Services shouldn't really be seamlessly trained.
This mean you're gonna,
We would love to, and we can certainly do some screening events to see who has needs. But, if you feel like you would like to start backup services, let us know and we'll work on getting an order. We can't evaluate you without an order.
Screen and give you recommendations that we think you may benefit, but we can't actually.
actually, that's the.
Yep, correct, as you, yep.
I think that to what you're talking about, my mom is on the other needs right now, and what you're saying about needing a new evaluation for somebody in a very active case.
So it hopefully will not be. They're working closely with Health Pro to get the list of everyone they're currently working with so that I can get orders and everything prior to their departure. And then that way we can.
So with New Year's week, you guys are gonna be busy.
They are still in on the cases through the end of the year. So the transition would happen the first week of January. So whatever you have planned for the next 2 weeks, like, we're gonna spend the next 2 weeks trying to make sure all of the orders are reestablished, and then we have a plan for the following week. Yep.
Okay.
And the good news, we've hired several of the health pro team members, so they're gonna be able to hybrid between both. They go.
Yeah.
Out.
Of advocation.
So what we do is evaluate people. We'll meet with Terry, Steve, and Jamie. Not set up yet, but typically once a week to go over the functional status of the residents, how that's reflected in their care. While they're doing great with therapy, need less help from them, we can pay for those adjustments to be made, or vice versa. You're starting to see that things are. I make sure that we make sure to have meetings with them on a weekly basis. That community about what we're seeing and what your progress on your care.